Right now in Jefferson City, Democrats have started a filibuster in the Missouri State Senate over Senate Bills 39 and 49. The first would ban student athletes from competing in sports not in line with their biological sex. The other would block gender-affirming care for transgender minors, including puberty blockers, hormone therapy, and surgeries. This comes just hours after the Missouri Attorney General issued an emergency order cracking down on gender interventions for minors. Tonight, pro-transgender advocates are voicing their outrage. New tonight, our Ryan Henson has both sides of the debate.
On Monday, a conservative political action committee organized a gathering at the Missouri State Capitol to rally in support of anti-trans legislation. The rally came as Attorney General Andrew Bailey announced emergency regulation for gender transition interventions for minors. In a statement, Bailey says, quote, "Because gender transition interventions are experimental, they are covered by existing Missouri law governing unfair, deceptive, and unconscionable business practices, including in administering healthcare services."
Gender-affirming healthcare is healthcare, plain and simple. It's really hard to imagine having these conversations about another form of healthcare.
Robert Fisher with the nonprofit Promo says this emergency regulation is unusual and discriminatory.
This really sets a dangerous precedent. If we are banning healthcare practices just because we don't understand them, we don't like them, what else can we ban? And just because we don't like it.
Fisher says gender-affirming care starts with helping patients make the social transition. For teens and older, puberty blockers and hormone therapy change the patient's body. Once adults, patients have the liberty to make decisions about gender-affirming surgeries. Bailey says even Europe recognizes that mutilating children for the sake of a woke leftist agenda has irreversible consequences, and countries like Sweden, Norway, and the United Kingdom have all sharply curtailed these procedures. The American Academy of Pediatrics supports gender-affirming care. Fisher is concerned healthcare options may be now pawns for politics.
Because there are a lot of trans kids, when they are not supported, unfortunately don't feel loved and accepted and end up not making it to adulthood, which is a really dangerous aspect of not being able to access gender-affirming healthcare.
Ryan Henson, 5 on your side.
Planned Parenthood, the largest provider to gender-affirming care, reacted in a statement tonight saying, quote, "Scientific evidence shows and the medical community agrees that gender-affirming care is safe, effective, and life-saving. The regulations will last 30 legislative days or 180 days, whichever is longer."
Right now, friends and family are desperate to